The interior compartment of the thigh muscles includes 7 muscles. Number 1, the Sartorius muscle and the 4 quadriceps femoris muscles, that is rectus femoris muscle, vastus medialis muscle, vastus lateralis muscle, and behind the rectus femoris muscle is present vastus intermedius muscle, and the 2 other muscles that are included in the interior compartment of the thigh are the Psoas major muscle and Iliacus muscle. These 2 muscles, that is the Psoas major muscle and the Iliacus muscle, originate from the posterior abdominal wall and descend into the interior compartment of the thigh. Because the distal end of these 2 muscles is present in the interior compartment of the thigh, that's why they are included in this group. First, we will begin with the origin of these muscles. The Psoas major muscle originates from posterior abdominal wall, and to be more specific, it originates from the transverse processes and bodies of the adjacent vertebrae from T12 to L5. The iliacus muscle also originates from the posterior abdominal wall, and to be more specific, it originates from the iliac fossa. As the name indicates, iliacus muscle originating from the iliac fossa. Next is the 4 quadriceps femoris muscle. First one is the rectus femoris muscle. The rectus femoris muscle has 2 heads. First one is the straight head, and it originates from the anterior inferior iliac spine. Second one is the reflected head, and the reflected head originates from roughened area of the ilium just superior to the acetibulum. Next is the vastus medialis muscle. It originates from the medial part of the intertrochanteric line, pectinal line, medial lip of the linea aspera, and medial supracondylar line. The vastus lateralis muscle originates from superior part of the intertrochanteric line, lateral margin of the gluteal tuberosity, and the upper part of the lateral lip of linea aspera. Now if you compare the origin of the vastus medialis and vastus lateralis muscle, then you will observe that the vastus medialis muscle originates from the medial part of the intertrochanteric line and the medial lip of the linea aspera, while the vastus lateralis muscle originates from superior part of the intertrochanteric line and lateral lip of the linea aspera. The vastus intermedius muscle originates from upper 2/3 of the interior and lateral surface of the femur bone. The last one is the Sartorius muscle, and it originates from the interior superior iliac spine. Also note that from the interior superior iliac spine originate the Sartorius muscle, and from the interior inferior iliac spine originate the straight head of the rectus femoris muscle. All the muscles of the interior compartment descend downward. Next is the insertion of these muscles. The Psoas major and Iliacus muscle combine together to form a common tendon called the iliopsoas tendon, and together insert on the lesser trochanter of the femur bone. The combined tendon of the 4 quadriceps femoris muscle is called quadriceps femoris tendon, and it is inserted on the patella bone. The vastus medialis muscle is inserted on the medial margin of the patella bone. The vastus lateralis muscle is inserted on the lateral margin of the patella bone. The rectus femoris muscle is inserted on the base of the patella bone between the insertion of the vastus lateralis and medialis muscle. The vastus intermedius muscle is inserted posterior to the insertion of the rectus femoris muscle on the patella bone. All the 4 quadriceps femoris muscle are indirectly inserted on the tibial tuberosity of the tibia bone via the patellar ligament. Last one is the Sartorius muscle, and it is inserted on the medial surface of the tibia near the tibial tuberosity. Next is the innervation of these muscles. The psoas major muscle is innervated by anterior rami of L1, L2 and L3. Rest all the muscles of the interior compartment is innervated by femoral nerve. To understand the innervation of femoral nerve more clearly, I will discuss it in some detail. The femoral nerve carries contribution from the anterior rami of L2, L3 and L4 and leave the abdomen by passing through the gap between the inguinal ligament and the superior margin of the pelvis to enter the femoral triangle on the anterior medial aspect of the thigh. In the femoral triangle, it is lateral to the femoral artery. As you can see, this is the femoral artery, and lateral to it, this is the femoral nerve. And here it innervates all the muscles in the anterior compartment of the thigh. Next is the action of these muscles. Since all the muscles are present interiorly, so their function is to move the structure interiorly on which it is inserted. To understand and memorize their action more easily, I will divide these muscles into three groups. First group include those muscles that crosses only the hip joint, and these include psoas major muscle and iliacus muscle, and their primary function is to move the femur interiorly, that is, flexion of the thigh at the hip joint. Next group include those muscles that only crosses the knee joint, and these include the three vastus muscles, that is, vastus medialis muscle, vastus intermedius muscle and vastus lateralis muscle. And the primary function of these muscles is to move the leg interiorly, that is, the extension of the leg. The last group include those muscles which crosses both the hip and the knee joint, and it include two muscles, Sartorius and rectus femoris muscle. And the function of these two muscles is both flexion of the thigh and extension of the leg. And since the Sartorius muscle is inserted on the medial surface of the tibia bone, it also helps in the medial rotation of the leg at the knee joint. Next, I will discuss the medial compartment of the thigh, starting with the gracilis muscle. Thank you.